I want to make sure we are all on the same page. And so I will briefly say that when we talk about racial trauma, we're talking about the cumulative effects of racism on an individual's both physical and mental health. So it's the cumulative effects of racism on an individual's mental and physical health, and recognizing that that trauma can be ongoing, as we've talked about, and it can be acute as we're experiencing now within this pandemic and some of the racial unrest and police killings. So when we talk about types of racial trauma, there are two specific types that we talk about. We talk about direct racial trauma, which is the type that you actually experience firsthand. So whether it's workplace discrimination, bias incidents, hate crimes, police-related racialized violence, dealing with microaggressions on some everyday levels, this is direct racial trauma. The other type of racial trauma that we are talking about is secondary or vicarious. And that is hearing about, seeing images of people experiencing some of these racialized incidents. So for instance, being able to see the image of George Floyd being murdered by the police officer, incidents that we see on the news, on social media relative to racialized violence, that too is a type of trauma that you are experiencing. When you take in those images, you are experiencing a particular type of trauma. So I really want to be clear about that and talk about the impact of that as we move forward today. So the question becomes, how do you know when you're actually experiencing some of the effects of racial trauma? We are in challenging times in general with this pandemic, the coronavirus, and now we've got this racial pandemic. So when you think about racial trauma, how do you know that that is something that you're dealing with? So I wanted to go over some of the typical signs and symptoms of racial trauma effects. So some of the typical signs are the following. So you become hypervigilant to threat. You are constantly on alert for signs of danger as you walk in the streets, as you're at work, as you're just going about your daily tasks. You have flashbacks and nightmares if you've experienced racialized violence, either at the hands of police or through other means. You may relive some of that through nightmares or flashbacks that keep rehashing and reliving the experience. You're suspicious, so you highly are concerned of people's intentions, whether or not they may do harm to you. There are also somatic complaints. So when we talk about physical health, you may feel that you have headaches consistently. You may feel like you have an upset stomach that cannot be attributed to any particular physiological issues that you're experiencing. You also may have issues related to sleep. You may have issues related to increase in addictive behaviors, under eating, anger, emotional exhaustion, just fatigue, feeling overly tired, more so than you typically may feel. You have issues of anxiety or depression, or you may feel that you just want to withdraw. You're not wanting to engage with people. You find yourself really in a situation where you don't want to engage at all. So these are some typical signs of racial trauma. These are also, I must say to you, typical signs of PTSD and post-traumatic stress disorder. And so one of the things that I want to talk about when we talk about systemic racism and challenging it is the fact that the mental health care system in which we currently operate is also very biased. So the issue of PTSD comes up because the manual that most psychiatrists, psychologists, mental health practitioners use, called the DSM-5, is utilized to diagnose clients, and then ultimately those diagnoses can be used to bill for insurance and allow clients to access services. When the topic of racial trauma comes up, the DSM does not actually recognize racial trauma as an acceptable form of traumatic experience. And as you can see, they only categorize direct exposure to physical and sexual violence as the means of acceptable traumatic experiences. So if you go and see a mental health practitioner and you're experiencing racial trauma with some of the particular symptoms, but you didn't actually have any incidents of direct sexual or physical violence, but maybe you know, through the vicarious trauma of seeing these images, that practitioner will more than likely not give you that diagnosis, which may make it difficult for you to access the kind of appropriate and affordable care that you want. And so this is a concern that we have relative to having the recognition that racialized trauma is an actual form of traumatic experience that should be recognized by most institutionalized mental health care systems. So what we recognize, though, unfortunately, is that in addition to all the other areas where we see systemic racism, the mental health care system here in our country is also culturally biased, as we can see and note relative to the diagnosis or not being able to diagnose racialized trauma. And that the challenge is also being able to find culturally competent practitioners so that you can engage with individuals who will validate your experience. The reality is less than 2% of psychologists are African American. I'd say less than probably maybe 5% or less just our mental health clinicians are Black. So we are continuing to struggle to address some of those numbers. So there's more than likely the possibility that if you are seeking care, it may not necessarily be with a Black mental health care provider. And so some of the concern that we have is that we want you to be able to have culturally competent care. We want to be able to advocate for the reality of experiencing racial trauma in the society. So this is something that we continue to advocate and work within these systems to address. So one of the things that we've seen, certainly with the rise of social media, is the impact of vicarious trauma. So we know and recognize that many of us have experienced violence at the hands of the police or at other racist type of incidents directly. But what we also see now, and for the most part, a good deal of us experience on a day-to-day, is seeing some of these images through social media, on the news, constantly being exposed to them. So one study found that half of African Americans surveyed had been exposed to one or more police murder of an unarmed Black man in their state during the previous 3 months. 50%. What that study found is that exposure leads to what they call poor mental health days, 2 additional poor mental health days due to this racialized police violence. So those days may be when you're really not up to doing much of anything. Maybe you take a mental health day or sick day because you feel traumatized, you feel upset, you feel angry, you feel frustrated. You know, as we went through these past few weeks, I know I've got a lot of feedback from Black clients saying how difficult it was for them to go to work with some of their white colleagues who were not really understanding some of what they were experiencing. And what we found is that white respondents did not experience that same level of effect to exposure to such police violence. And so for many of my Black clients, they did take a day off. They did decide that they were just not up for engagement relative to this particular situation. And so we understand now that there's great effects that the media has in exposing us to vicarious trauma related to racialized violence, especially police racialized violence. So constantly seeing these images, and we have access through our phones, through our iPads, through the news media. So we're constantly seeing these images, and they do have a particular effect, whether or not we are always aware of it. So I wanted to make sure that we talked about that because it can lead to poor mental health outcomes, as we talked about anxiety, depression, PTSD, just withdrawal issues related to not wanting to engage. And so I wanted to now take a moment to talk about specifically the impact of racial trauma on children. And one of the things that I wanted to note was that a recent study found that Black adolescents experience discrimination at least 5 times a day. At least 5 times a day, they had distinct experiences of experiencing racial discrimination. And usually, given the technological age that we're in, it's really mostly online. So either racial teasing or online anti-Black racial microaggressions that they see in their feeds and when they're engaging with different acquaintances. So these are some concerns that we have in terms of what our children are being exposed to, especially how the study found that children who are exposed to that level of racial discrimination experience higher rates of depression. And so as a parent, as a caretaker, as someone who cares about young adults, young people, it's critical that we are able to understand what our children are experiencing, what they're consuming online, how it's having an effect on them. So being able to speak to your children about these experiences and helping them to cope will be essential in helping them to deal with the racialized trauma that they're experiencing. So the challenge of the moment is that for many people, especially Black people who live in this society, police harassment, police killings just almost become commonplace, that it's something we become so used to that some of us are almost numb to it, unfortunately. But what I'm here to say today, and the reason we've come together in community to talk about this topic, is that it has impact. It has mental health impact. It has physical health impact, that we cannot accept that this is just the normal way to be. And I remember getting, I got my start in the world of counseling, working at a high school for students who were kicked out of previous institutions and were having an opportunity to graduate through this particular high school, alternative high school, at which I was a counselor. And I remember talking to a young man at the time who told me that because the school allowed students to be in the program until they effectively aged out, which was around the age of 19. And this young man looked older than his age, but he used to tell me that every day, every morning before coming to school, he would be stopped by the police who did not believe that he was a student. And so he had to constantly prove to them that he was a student and he was headed to school. And so I think about the trauma that that young man experienced on an everyday basis, simply trying to go to school, and understanding that every interaction with the police can be traumatizing, can have an effect, that it shouldn't be, oh, well, that's just how it is. I'm just used to being stopped by the police. Oh, that's just how it is. I'm used to be patted down by the police. No, this is a critical moment to recognize that that type of engagement is unacceptable. We've known that for so many years, but now it's time for us to say that it's also having an impact critically on the health of ourselves and our children. One of the issues that I've advocated for many, many years is this issue of police in school. And so for so long, especially here in New York City, there was a turn where school safety officers were turned over and became employees of the NYPD. And under the guise of keeping schools safe, that was the reason and the rationale for doing that. But what we found, as you can imagine, is that the rates of arrest, the rates of harassment of Black and brown bodies is much higher, especially in our public school systems, than anything related to actual crime. And so they always tend to advocate and say, well, if the cops are not in schools, then the schools will not be safe. My concern is, again, the mental health impact of students feeling that they are under watch of a occupying force, and having to deal with the fact that these officers are not necessarily there to support them, but to police them, which causes them to feel concerned, to actually not feel safe related to that. And so talking to students who have that experience and recognizing that it's a public health concern, that being able to understand that the vast majority of students are not engaged in any type of criminal activity. The vast majority of students do not necessarily need police protection in the hallways, and they're not receiving police protection. So that's the actual reality of it. They're more so concerned about being harassed, and that is something that I think is important for us to recognize. So we talk a little about racial trauma. Now I want to transition into Black rage and pain. And so I want to use this quote from Frantz Fanon, the revolutionary psychiatrist who wrote Wretched of the Earth, among many other works. And this is a direct quote from him, which says, when we revolt, it's not for a particular culture. We revolt simply because for many reasons, we no longer can breathe. And it's such a fitting quote in thinking about George Floyd and thinking about Eric Gardner and thinking about all these particular incidents where people literally are not able to have breath and have lost their lives. And so what Fanon is talking about is that once you get to a point that you feel like you have no other option, that is where revolt may happen. And so we're in a moment in time where there is an opportunity for change. I think more and more people understand that we've been under the knee of the United States for so many years and suffocating our ability to live and to breathe. And we're saying we really want something different. So when we talk about Black rage and pain and how it's used to, in essence, create feelings of danger and have the citizenry feel that, well, we need more law enforcement, we need more types of protection, when we know that's not the reality, we ask the question, well, why are we angry? Why are we in pain? And I'm sure all of you know why, but I really want to be able to bring it home as well, that we've lived under systemic racism from the moment we stepped on, the shores of this country. So in all facets of our lives, housing, education, healthcare, employment, all the things you can think about, the constant brutality and murder at the hands of the police, consistent and aggressive, as I say, disregard for the humanity of Black bodies and minds, and over 400 years of cultural gaslighting. And when I talk about cultural gaslighting, I'm talking about denying our experiences of suffering under oppression and racist tyranny. So these are some of the reasons that we get to the point of saying we are angry, our young people are angry, and we don't want them to be vilified in terms of viewing them as, animals or predators or opportunists. These are some of the reasons that we are angry. So when we talk about the factors that influence Black pain and rage, there are a variety that we can point to, but these specifically are the ones that I want us to address. One, a sense of a loss of control. And so what we all want in our lives is to be able to feel that we can control our lives, being able to control and be safe in the places that we walk, the places where we work, where we live. So when you lose that sense of control, that sense of power, hopelessness can set in. When you are constantly being discriminated against and assaulted through either racial microaggressions or just, quite honestly explicit racist bias, that tends to have the anger and pain build up. When you feel socially isolated and marginalized, that the society, the culture tells you you don't belong or you're less than, that causes that level of pain and rage. So as we understand the context of racial trauma and the context of Black pain and rage, we now want to talk about how we can actually cope with these issues and how we can channel some of our pain and rage into productive means to really affect change. And so there are 4 things that I talk about when we talk about coping with racial trauma and channeling Black pain and rage. First is being able to articulate emotions about the experience. And I'll talk a bit more about that, but being able to share and understand and process the pain of the experience, the anger of the experience, is critical to helping you to move through and past it to be able to function and cope. To know and understand your triggers and limit exposure to some of those triggers. So we'll talk a little bit more about what those triggers may be. To commit to consistent self-care, to really know and understand that in a society that in many ways wishes to annihilate you, that you want to be able to find the means to take care of yourself each and every day, to really forge the resistance to live and to thrive. And then activate your sense of power, because as I talked about, when you feel like you've lost power, you've lost control, then you can tend to feel that you are much more angry and in pain. So the first area that we talked about was articulating emotions about the experience. whether it's being stopped by the police directly, whether it's seeing the image of George Floyd, whether it's hearing about Breonna Taylor, whether it's having conversations online with people who may not necessarily share the vision of what racial justice should be, it can be very triggering and angering for you. So denying those, suppressing those emotions can cause physical and psychological harm. So we want you to be able to have spaces to share some of those emotions. And emotions can be varied. So they can be negative ones: anger, pain, frustration, anxiety, depression. But they can also be positive: hope, optimism, seeing people, really in the streets protesting, trying to struggle for racial justice. Understanding the societal implications, especially for men to share emotions, we want to be able to make sure we build room and permission for men to talk about their pain, to talk about their anger, to talk about their fear. I saw a very powerful image of a young man who was protesting in Grand Army Plaza, a 26-year-old young black man who, when they asked him why he wanted to protest, he's talked about really wanting to have the opportunity to have children, to travel the world. He wanted to be able to have the opportunity to pursue his goals. And as he was talking, he was tearing up. And it was powerful for me. And I started to tear up as well, because I know, that it's a struggle. So being able to say to men that you can cry, you can have pain, you can have fear, that it's all right, allows us to process some of these traumatic experiences. And recognizing that anger sometimes can be a secondary emotion. So certainly you can be angry related to some of the experiences, but there may also be other things, as I talk about, underneath that. So whether it's fear, whether it's anxiety, whether it's other concerns, I think it's something that you oftentimes want to be able to address. That if we see, especially in a society, young angry men, young angry black men, young angry black women, then we automatically feel like the only issue is about anger. And so we only address it in that way. Either we penalize them or we punish them in some way, but we don't necessarily engage with them to understand what may be some other emotions that they're experiencing related to all of what's going on around them. Knowing your triggers and limiting exposure. So as I said, it's very hard to limit your exposure when you are constantly online, either taking in and consuming the latest events, wanting to know what's happening. And I think it is important to be informed, but I think it's also important to be self-protective, to know that if you consistently see some of these images and they trigger you, they get you anxious, they get you angry, they get you upset, that yes, we want you to be able to talk about some of that, but at the same time, we may think that it might be useful for you to limit your exposure to some of those images. It might be useful for you to limit, discussions with individuals who may not necessarily be as welcoming and open to your views. It may be, recognizing that when you experience microaggressions at work or in the community, that also can be a trigger. And so when we talk about racial microaggressions, I don't want to assume that everyone knows what it is that I am talking about. So I will take a step back and say racialized microaggressions are those small slights, indignities that you may experience in a way that communicates hostility to you based on your background and your identity as a Black person. So again, for instance, it can be in the form of what we call micro assaults, micro insults, micro invalidations. So micro insults are just old-fashioned racism that you will see through racial epithets and things of that nature. But then there are times where someone may say something like, oh, you're very articulate. Like one of the things that I used to get a lot, as if to say that it's a compliment, but the assumption is, well, I'm surprised as a Black man that you can speak so well. So each of these small slights, as I talk about, can be like paper cuts. One paper cut may not be that painful, but if imagine you get 1,000 of those cuts during the course of a day or a week, then it builds up. And we want to know and understand that if you're experiencing that, we want to make sure that you can talk about it, but also limit some exposure to some of it as well, if possible. So the key piece to talking about and dealing with trauma, processing the experience, limiting and knowing your triggers, limiting your experience. And when we talk about healing, we're talking about self-care. And when some people hear this word, they feel that it's just frivolous. It's not something that, it seems selfish to talk about that, especially in the midst of a pandemic and all the racial unrest. And what I talk about is, in order for you to be the optimum advocate, the optimum racial justice person and fighter, you want to make sure that you are well as best as possible, that you have the energy, you have the ability to fight the good fight, if you will. And in doing so, one of the things that's important is to recharge your battery, to make sure you're taking care of your needs. And as a helper, oftentimes we can feel so focused on helping everyone else that we don't recharge our battery and fill up our own tanks. And so I want to take some time to really talk about self-care. So really being able to commit time and build space in your life. It's challenging with so much going on, especially with the pandemic, especially if you're experiencing this work from home phenomena and feel like you're working more now than you were before. But building time out to do things that will take care of some of your needs, I think, will be critical. Valuing it, again, as essential to your emotional and physical well-being, not as something that's frivolous. And then finding someone who I call an accountability partner, someone you respect, someone you will know and listen to say, okay, now it's time to take care of yourself. What are the goals that you have? And they will check in on you every week, every day to make sure you're responding to that. So think about your self-care strategies. If I ask this question and you're at a loss, that means that you're not actually doing the things that you need to take care of yourself. So let's talk about some of the key typical ones that are of importance. So sleep, sometimes we take it for granted. So we talk a lot about sleep hygiene, and I talk a lot about this, especially in this time with my clients, especially as you may be overworking now, feeling like as soon as you wake up, you need to go, you're on and you're working, and then you don't actually stop working until you go back to sleep. And so what you want to do is maintain a consistent schedule, have a start and end time for your actual, quote unquote work if you're working from home. The minimum amount of sleep that we talk about an adult needs to be able to have good reserves is 6.5. Core sleep is 5 hours. So being able, that's the minimum amount of sleep your body needs to kind of physiologically recharge. So have a winding down routine, at least an hour before bed, decrease blue light that's coming from your phones, that's coming from your iPads, that's coming from the television. As much as you can, not have those stimulating devices in the bedroom like the phone. I know many people use it as an alarm clock, and thinking about other ways to keep it apart and separate from that. And being able to deal with any night wakings if you're having sleep disturbances, thinking that the bed, again, should only be used for typical functions. If it's not become your workspace, that's a challenge. And I know with, there may be constraints related to that, but as much as you can keep sleep in that particular way, I think it allows you to restore some of your energy and your reserves. And then make sure you're getting access to at least 15 minutes of sunlight every day. Meditation. So there are a variety of different ways to meditate. I talk about mindfulness, really being present in a moment and being able to embrace and accept that moment. Loving kindness meditation talks about giving yourself the opportunity to be kind to yourself. We can beat ourselves up, especially when we're going through this current moment, feeling like maybe we should be doing more to fight for racial justice. Maybe we should be doing more to help out, and we beat ourselves up. Loving kindness meditation means that you spend some time just reflecting upon why you're grateful to yourself, how you can be kinder to yourself. And I think it is critical that we're all kinder to ourselves in this moment. Using some of these meditation apps may be useful, Headspace Calm. Breathing techniques. So I know that my colleague, Dr. Ma Lewis, in the previous Harambee initiative, did a whole overview about breath work. and she is an expert in that area of breath work. So breathing is such a critical piece to building in relaxation and getting us into a relaxed state. And there are a variety of different techniques that are out there. And so these are three that I talk about specifically: coherence breathing, box breathing, and the ha breath. And so coherence breathing is where you breathe in through your nose for a count of 6, breathe out for a count of 6, and then you're able to do that consistently for 20 minutes. And if you do it 20 minutes in the morning, 20 minutes at night, what they found is that it has great physiological, physical, and mental health outcomes for you. It brings relaxation to your body. Box breathing is another form of breathing where you're envisioning actually forming a box as you breathe. So it's, breathing in through your nose for a count of 4, holding for a count of 4, breathing out for a count of 4, and then holding for a count of 4. And you repeat that cycle for at least a 5-time cycle to be able to, again, bring you to a state of relaxation. And then finally, the ha breath. And the ha breath is a breath wherein you take the energy starting from the bottoms near your ankles, rising up through your body, bring it to your torso, and then distinctly saying with your hands, ha! It can be very startling when you do it. One of the things I talk about, though, when you do the ha breath is to not do it in front of, any person, because you're releasing a particular amount of energy. It's great as a form of releasing anger, but you want to do it in a space where it's not being directed at a particular person. There's a book that I recommend called The Healing Power of the Breath wherein you can learn about these particular breathing techniques. Okay. So exercise, nutrition, really being able to do some types of activity. Again, it's been difficult in quarantine, but doing something that allows you to regulate mood 30 minutes 3 times a week might be helpful. It also allows you to release some of that anger energy. Culturally competent therapy. So I talked a little bit earlier about the challenges of finding this, but it's so important to find someone who can validate your lived experience, can help you to gain insight about your trauma and how you can cope with it, that can provide the emotional support that you need, and can help you in implementing effective self-care strategies. Social support, so connecting with the community, being able to see that there are over 80 people here on this call really heartens me to recognize that when you build with people in community, it can be energizing and healing. So reach out to those people who honor you and your values, and be able to engage in these healthy conversations focused on self-care and agency. Other self-care strategies we talk about, laughter is so important. Gratitude journaling, thinking about, things you're grateful for, listening to music, being able to engage spiritually, religiously, thinking about the things that you need to fill up your tank. And then finally, I talk about activating your power. So a good deal of the time, people are trying to figure out, well, what can I do in this moment? What is it that will make a difference? And we recognize, as I said, this is a long marathon. I remember being in my 20s, recognizing that if I dedicated my life to racial justice, that it would be a lifelong endeavor, that I might not necessarily see the end of it, but that I was heartened that I was playing my part and contributing in the ways that I felt that I could during the span of my lifetime. And so being able to think about the things that you can focus on in your control. So again, taking care of yourself, thinking about activism, advocating for racial justice in the ways that you can access, supporting organizations, joining organizations, donating to causes, lobbying for legislative change, using your gifts and talents in service of racial justice. So one of the things that I've been doing a great deal of time, especially when the pandemic started, just in general, was being able to use my talents and skills as a mental health provider, as a psychologist, to think about what it is that my community needed, how I could engage. You all have gifts and talents that you can provide for the cause of racial justice. So being able to take up your power, I think, is so critical and important when you're thinking about moving forward in dealing with some of the reality of the situation today. So finally, what I would want everyone to be able to leave with is an action plan for how you're going to deal with the trauma and heal the pain and the anger. So I want you to think about some of these questions. One, how is it that the racial trauma, the pain, the anger, how are they impacting you on a daily basis? Are you more irritable? Do you feel more heightened to engagement? Are you feeling angrier that you can't function or cope with the people that you typically function and engage with? Are you feeling more withdrawn? Being able to, again, recognize some of these as well in your children, in your partners, and those that you care about, to recognize that maybe they need more support. They need you to recognize that they are suffering. But I want you to ask that question first and foremost for yourself, and then to take it to those that you care about. And then think about one strategy that you can have for your self-care and one goal that you have to activate your power in this moment. And think about one step you can take today to implement that or to move forward toward it. And then finally, think about who your accountability partner will be in that moment, who you can turn to, who you can say, here are my goals of trying to deal with my racial trauma and healing my pain and anger. And here's what I'm working on. I want you to check in on me and really make sure I'm moving forward in that moment. So key takeaways, it's so important to understand how racial trauma, pain, and anger are impacting you on a daily basis. Maintaining healthy coping tools will help reduce the impact of that trauma, pain, and anger. And then having an accountability partner will help in achieving your coping goals. And so with that said, I've ran through a lot. And so I'm really excited to be able to now engage with some questions.
Yes, so I am looking at the chat box. And there's also I believe the hand raise feature. So
right.
there's different ways that people can ask questions. There is the chat box. Oh, there is a question here. Please repeat the definition of racial trauma. So
the definition of racial trauma is the cumulative effects of racism on the mental and physical well-being of an individual.
Thank you. Okay. And the next question, what is the organization doing to press the APA to include racial trauma in the DSM? That is that's a very important question. That's something that we're going to need to discuss because there has been a lot of criticism that Dr. Orbe-Austin was referring to the fact that as it is, the DSM pretty narrowly defines what trauma is, and it doesn't really get at what our experiences are. So that's something that we're going to need to take a serious look at. Are there studies or efforts in progress to make racial trauma and ICD codes? It's sort of a related question. Is it, I'm not sure about the second part, but
is it dependency? Mm-hmm. There is actually some work around the ICD codes and being able to address that, and so there's more movement on that end than on the DSM end. So there's certainly some work to recognize racial trauma in that arena as well.
Okay, and there's a few more, but could we use a diagnosis of acute stress?
Yeah, well, you can. The challenge becomes, again, being able to talk about, well, what is that stress and what is that stressor and how that's then perceived. Because if the stressor is being able to say that I'm seeing all these images of Black bodies being killed by the police, and again, to the point of the provider, how will that person then define that and feel like that is a stressor that can then be used to say that you're suffering from, that disorder.
Yes. Let's see. Sorry. Okay. So dependent on the. So the next, let's see, excellent presentation. What guidance would you give to individuals who are not supported by their employer to engage in racial justice efforts on the job or to address lack of attention to what's going on? That's a
great question. And one of the things that I talk about, back to identifying communities of support, if your employer is not doing it directly, if you can then find colleagues who will advocate for you for them to do it. And thinking about the means to have that type of support. So if you're the only person in your organization advocating for it, it's very difficult to affect change. I would not say not to do it, but to know and understand you'll meet a certain level of resistance. And so I talk about building a case by having a community of support and allies to say, this is an issue and a concern we want to address. And then recognizing that ultimately you want to find some of that support maybe outside of the workplace. And then ultimately thinking, well, is this the actual place that I need to be? Which is a harder question of, if it's so culturally toxic to me, if it's so racially corrosive to me, is that healthy for me? And should I continue to be there? But I first start with building communities of support to advocate on your behalf.
Thank you. Okay, let's see. Is there a way to get the sources for the studies you included in your presentation?
Sure. So I guess what I can do is send it to Dr. Collins, and then we can figure out and facilitate a means to, send that forward to folks who are interested.
Definitely, yeah, I can see. All right, this is an announcement. I'm Dr. Roy Aranda, and we'll have an internet-based TV show on June 18th entitled The Dual Pandemic of Racial Discrimination and Coronavirus. May I display some of his slides? You can send those to us. Our email address is NYABPsi, so that's NYABPsi1 at yahoo.com. Let's see. How do we address the dearth of Black psychologists? It's a big question.
So we continue to do what we're doing here and building and support. The challenge is constantly and consistently that the way psychology is practiced within the confines of these particular systems makes it difficult for Black individuals to kind of continue through the pipeline. So the research indicates that if there's a fair amount of African-American students who are pursuing psychology as an undergrad major, then there's a less, then it decreases as we go through the master's piece, and then it really plummets when we get through the doctoral piece. And so part of the work that we've done and continue to do, one is to provide mentorship and support, but some of it is just a financial reality. And I think it's building capital to the point of saying we will support these students to get through some of these programs to come through on the other side, and recognize that, one, it is a possibility to come out on the other side. As we can see, there are plenty of Black psychologists, Black mental health professionals on this call. So it's continuing to provide that level of mentorship and support.
Let's see. Okay. Well, what is the organization doing to encourage more professionals of color? For the less than 2% of Black therapists, it's emotionally taxing to help those in need. Very good question. So one of our primary goals is to provide mentorship to the incoming generation of psychologists. So that's a big part of how we, I guess, encourage we'll increase the number. And we are going to continue holding events such as this one, healing spaces where we have conversations, do experiential exercises together. So do keep in touch with us. I'm going to be including a link so that you can join our mailing list and also take a look at our website. Thank you for asking that. Let's see. So we only have a few more minutes, so I maybe suggest that we close the questions because there's a few more still. What are some strategies you can recommend for Black practitioners who are coaching, engaging Black patients, and absorbing the suffering and trauma while carrying their own? Very good question.
So, and it's a great question. And we talk a great deal about the vicarious trauma of helpers, and recognizing that as you are a helper, you are taking in different pieces of pain and trauma. And so you need to make sure you're doing your own work and getting your own support. and really voicing that and voicing how difficult it is to take that all in that way. And so having these healing spaces, having to make sure that you have the types of support through mentorship, through your own therapeutic work, to recognize that it is something that's important to discuss.
Wonderful. Okay, let's see. There were just a couple more. How do we begin to organize and mobilize to have racial trauma as a diagnosis in the DSM?
So, as Dr. Collins said, I think the different professional associations need to advocate. So the New York Association of Black Psychologists, the National Association of Black Psychologists, Association of Black Social Workers, like all these different mental health practitioners need to be able to continue to advocate. The reality is that the DSM is updated on a particular periodic basis. And so some of the advocacy is continuing and started back up and needs to be in preparation for the next iteration of it, so that we have to make sure that we're part of the voices in the room as some of these discussions are being led and held. And so I think that's the critical piece of this, of recognizing that there will be plenty of working groups. It takes a few years for the new iteration to come out, to making sure we're in those rooms as some of those discussions are being had.
Okay. And then there are some comments about sort of differential diagnosis, acute stress versus other things. So the next question is, let's see. Oh, I believe there is such a thing as healthy rage. What are your thoughts? When is rage healthy? How can you discern that?
Well, it's, when we talk about, I talk a great deal about righteous anger, right? So it's being able to know and understand that, does it have a corrosive impact on your functioning is the concern. So to have righteous anger is to say that I am angry and I have the right to be, based on some of the things that I'm fighting for or fighting against. And so, yes, one of the things that I talk about is it's healthy to be able to be angry and to have that level of rage. But if it becomes corrosive to your functioning, if it doesn't allow you to cope in the ways you typically want to cope, if it consumes you in this particular manner, that's when it's more of a concern in terms of it being unhealthy.
Wonderful. Okay. I'm just scanning to see if there's anything else. Okay. Okay. All right. So there are some words of thanks, which I want to echo. Thank you so much, Dr. Orbe-Austin, for this wonderful presentation. I think it was a number of things, informative, but it also had some really important takeaways for us. And I hope that everyone feels better equipped to manage some of their difficult feelings, the sadness, the helplessness, the rage, the trauma. Thank you.
Thank you, and it's been my pleasure. So I want to leave with actually two quotes that I think a great deal about as I do the work. And so the first is, at the risk of seeming ridiculous, let me say that the true revolutionary is guided by great feelings of love. And then the last one is, we are the ones we've been waiting for, by June Jordan, the poet. And so oftentimes we're looking for leadership, we're looking for guidance from others. And I just want to say, one, it is really, at the end of the day, the love of our people, the love of each other, the love of the Black community that will carry the day, and that we're the ones that we've been waiting for. So now is the time for us to continue to be in community, to advocate for racial justice and change, and to heal. So thank you for the opportunity to share with you all, and thank you for the opportunity to be in community. I wish you all the best of luck and love and light.
Thank you. Thank you. On that note, we are going to end for the night. Thank you all again for being in community and support with us.
Thank you, Doc Collins. Thank you, NYABPsi. Have a great evening, everyone.
Good night, everyone.